Hey, welcome to another video. I'm Dr. Otterson, and today I'm going to talk to you about veneers. We ask ourselves a lot of questions when it comes to veneers. What size and shape do I need to get? Is there a color that works best or looks most natural? What's the cost of veneers? And if I get veneers, am I going to have any issues with them in the future, maybe 10 or 20 years down the road? So I'm going to take some time to talk about each one of those topics and hopefully answer all of your questions so that you can make an informed decision when getting your dental veneers. Recently, I was asked a very interesting question from a friend of mine. She asked if she gets dental veneers, is there anything that she has to worry about in the future? Any other problems that might arise after she has those veneers on? And I told her yes. I mean, absolutely there is. Whenever we get any treatment done to our teeth, we also run the risk of having future problems. These problems are pretty minimal and not likely to happen with veneers, but I want to discuss those so that we're all aware and well informed when we make that decision to have our dental veneers done. So I want to turn our attention over to the whiteboard here, and what I'm going to do is sort of point out a couple of things, how dental veneers are made and why we do what we do. So if you look here, this is the facial surface of your tooth. When you smile, this is what everyone sees, and this is what we don't always see. It's sort of a side profile of that front tooth. This being the front edge, this being the back edge. And what I've drawn here in this red line, that is the reduction zone. So we actually have to reduce some of the tooth structure on the front of our tooth and also reduce a little bit of tooth structure here on the incisal edge or the biting edge of our tooth. The reason we do that is we have to have some bulk of porcelain so that if we have occlusal forces on here, we bite into an apple, we're not going to chip that porcelain or have that veneer just shoot right off of our tooth. We just have to have something to hold on to. So this would be our classic reduction for veneer. There are some alterations to veneer preparations, and that's just based on what you start with, what your teeth look like before, and what needs to be done in order to create that perfect smile for you. So one of the reasons that we make this reduction is so that there's space for that veneer. If we just place a veneer on top of your tooth without any reduction, you're going to have like this horse smile, as I like to call it. Your teeth are going to be very bulky, flared out looking. It's not going to look natural. It's going to look like you put some acrylic fingernails on your teeth or something like that. So we do that reduction so that when the veneers go on your teeth, it looks natural. It looks like what you had before. Only difference is now your teeth look beautiful and white. So back to what my friend's question was about whether or not there's harm done to the tooth or whether or not there's going to be problems in the future. We did reduce some of the tooth structure. So what this results in is you might experience heightened sensitivity on your teeth, more sensitive to cold and hot and other things. Typically, once the veneers are on, this sensitivity goes away within 2 to 3 weeks, but it does persist in some people, and usually the sensitivity is pretty minor and can be managed. But on top of that, now that we have a margin on the tooth, essentially where the tooth meets the veneer, at that margin, we're now a little bit more prone to having cavities form in that area. So we need to keep that in mind and know that when you get veneers, it's super, super important to brush and floss daily. A lot of people will come in wanting veneers, and unfortunately what we see is somebody who doesn't brush their teeth, who has a lot of cavities, who might even have gum disease. Veneers are not for that type of person. Before we do veneers on somebody, we want to make sure that that person's oral hygiene is in check. We want to make sure that that patient doesn't have a lot of plaque buildup on their teeth, that they don't have a lot of cavities in those areas. And if they do, they really kind of have to show that they are motivated, that they're going to take care of their teeth, brush, floss, do the things that they need to do so that these veneers last a long time. You'd really, really hate to spend thousands of dollars on your teeth just to get a cavity 2 or 3 years down the road that results in you having to fix that cavity and replace an entire veneer because the margin's been broken down beyond repair. So keep those things in mind when you're getting veneers. Make sure that you are ready and willing to take care of them like it's your own child. Okay, you're spending thousands of dollars, you don't want to waste it. So let's talk a little bit about how do we decide what color and what shape of veneer we want to have. So one thing that dentists think about, or what they take into account when they're preparing to make dental veneers for you, is they take into account your age, they take into account your gender, and they take into account your skin complexion, because all these factor in what color is going to look natural for you. Also, what shape of veneer is going to look natural for you. Typically, as you see here, this would be sort of a typical tooth shape. It's not perfect, I drew this, and I might show some pictures on the side of what a typical tooth looks like. For men, that tooth is maybe a little bit more squared off at the edge, whereas for women, the tooth might be a little bit rounder. And hopefully I can show you in some images here. And so when we're designing the veneer, we might design for a female a little bit more rounded off edges, whereas for a male it might be a little bit more aggressive lines that typically look a little bit more masculine. But everyone's a little bit different, so a lot of times we'll just take a snapshot of what you looked like before and try to mimic some of those same line angles so that it looks natural when it's all done. The other factor, as I said, complexion, age, these are more important factors for the shade, or how white we want that veneer to be. If you have very light skin complexion, light colored hair, you can get away with having very, very white veneers. But somebody with a little bit darker complexion, maybe they have tan skin, or they're, I don't know, maybe they're aged. As we age, our teeth naturally get darker. So putting a very white veneer on someone like that with very dark complexion, very aged skin, that white tooth is going to look very fake, and it's going to be very noticeable by people around you. So we don't want to go for that fake white toilet bowl color. We want to go for something sort of a little bit darker, but still in that bleach category, and that's going to give us that beautiful white smile that we want, but hopefully keep us in that realm of what's natural, so that we can fool people into thinking that our teeth are just naturally beautiful and perfect like that. Know that this is also a very expensive procedure, and I want to get to that as well, because it's also another question that I get asked commonly is, how much do dental veneers cost? Typically, a single veneer for one single tooth is anywhere from $1,000 to $2,000. That depends on whether you go to a general dentist or a specialist, or even can be dependent on the state that you live in and what their fees are. It might be higher or lower in different states. But generally speaking, you're gonna spend about $1,000 per tooth. So in a typical case of somebody just wanting veneers on their upper teeth, you're looking at 6 to 8 teeth. So anywhere from $6,000 to $10,000 for just upper veneers. So keep that in mind. It's very pricey, but if it's something you want, you'll take care of it, and it'll be worth it to you, I think. If you don't have that kind of money, or you still want to have your teeth look prettier or look a little bit nicer, there is another option, but it comes with a lot of other downsides. So I'm sure we're all aware of white fillings that we get. They're called composite fillings. We can also create chairside composite veneers, where the doctor still does this reduction, but then places composite resin over the top of your teeth, shapes them to look really pretty, polishes them up nice so they're shiny, and they look just like a veneer. Maybe with some of the perfections taken out that you can get with a lab created veneer, but they are relatively similar and look very, very nice. The downside to a composite veneer is they're still able to get stained, just like our natural teeth. So you might get a very white composite veneer. 2 or 3 years down the road, that composite veneer is already starting to get stained and maybe looks a little bit dingy. Those composite veneers cost in the maybe hundreds of dollars per tooth versus thousands of dollars per tooth. So it is an option. It's maybe not the option that I would go with if I was going to get veneers, but it's out there. There are multiple options for having, veneer quality looking teeth. So I really hope that what I discussed here today sort of gives you a little bit more insight on veneers and answer some of your questions. If you like this video, please subscribe and like the video. I'd really like to make more content like this. Let me know in the comments below what you'd like to hear about next, and I'll try to start doing some videos a little bit more frequently here.